Good afternoon to everyone, and welcome to this month's NCORE Connect and Explore webinar. Our topic today is Advancing Physical Activity Research and Practice with the PARO framework. And in just a few minutes, we'll be getting to today's presentation. And after that, there'll be a chance for Q&A with our speakers, and then we'll close out with a few quick announcements. My name is Karen Hilliard from the NCORE Coordinating Center, and I will be your facilitator for today. I'd like to introduce to you today's speakers. Our first speaker is Brahmaramba Kauta. She goes by Brahma. Brahma Kauta is a health scientist in the Office of Disease Prevention at the National Institutes of Health, and she is responsible for promoting collaborative research projects and leading disease prevention efforts across institutes at NIH, including addressing health disparities and the leading risk factors for morbidity and mortality. As a health scientist, she contributes to efforts to identify prevention research gaps to facilitate the development of concepts for scientific initiatives, workshops, and meetings. Before joining NIH, she served as a project officer and registered dietitian nutritionist group leader at Health Resources and Services Administration, or HRSA. Ms. Kauta has years of experience in clinical and community nutrition, obesity, and physical activity. She also has 2 master's degrees in food and nutrition and food science. Our second speaker for today is Laura Bayless, and Dr. Bayless is a senior research scientist at the Center for Nutrition and Health Impact. Her research focuses on implementation strategies to support the uptake of physical activity, environment, and policy interventions in community settings. She is the lead developer of the Implementation Strategies Applied in Communities, or ISAC, compilation and the ISAC Match Implementation Strategy Selection process. So welcome to today's speakers, and we'll be looking forward to hearing from them in just a moment. First, however, a couple of housekeeping notes. If you need technical assistance or you're having trouble logging into the webinar, please email us at ncore@fhi360.org and we'll work with you to resolve the problem. Also, if you have a question for our speakers during the webinar, you can put it in at any time. You don't have to wait until the Q&A begins, but we do ask that you please write it using the Q&A feature on the bottom of the screen. So if you have questions, please put them in and we will get to as many of them as we can by the end of the webinar. And now, it's always helpful to our speakers to know who is in the audience. And so we have a question for all of you today. We'll put the poll up and you can respond. The question is, what profession or sector do you identify with? And if more than one applies, you can select all that apply. Are you a research person, policy, practice, a student, a funder, maybe something else, or some combination of those? We'll give everybody just a moment to reply to the poll. All right, we'll give you just another moment. I think almost everybody has responded. If you have not, go ahead and put in your responses. Again, you can check all that apply to you, the profession or sector that you identify with. And we will close out the poll in just a moment here. Still see a few responses coming in, so I'm giving you a moment, but we'll go ahead and close things out in 3, 2, and 1. All right. And as you can see, there's quite a mix of things out there, but it looks like the vast majority of folks in the audience are involved in some kind of research, and then maybe also combined with that, some of the other areas, policy, practice, funding. We have some students out there. Welcome to all of you. We are so glad that all of you are here, and I think you're really going to enjoy today's presentations. So now on to the spotlight for today, advancing physical activity research and practice with the Physical Activity Research Opportunities, or PARO, framework. And let me go ahead and hand things off to Brahma Kauta.
Thank you, Karen. Hi, everyone. As Karen mentioned, my name is Brahma Kauta, health scientist in the Office of Disease Prevention at NIH. As a lead for the Physical Activity Scientific Interest Group at NIH, I would like to provide some background on how we arrived at this project. Next slide. Physical activity is a cornerstone of children's health, extending far beyond weight management. It supports cardiometabolic health, mental health, and learning, and reduces risk for chronic diseases. Despite these benefits, most US children fall short of recommended activity levels, highlighting a critical opportunity for prevention. As you know, national guidelines recommend at least 60 minutes of daily physical activity for children and adolescents. Many children do not meet these activity recommendations. 2018 physical activity guidelines identified needs for further research on health effects of physical activity during childhood and adolescence. And the needs differ across groups based on sex, age, race, ethnicity, and socioeconomic status. And they also encourage to examine the effects of novel forms of physical activity, including high-intensity interval training on health outcomes in youth. Healthy People 2030 is a federal initiative that has several physical activity-related objectives, and many focused on children and adolescents. Most of the physical activity objectives for children and adolescents are showing limited progress, with advances occurring at a slower pace. Finally, CDC's Active People, Healthy Nation is also focused on promoting physical activity by getting 27 million people more active by 2027. Next slide. Physical activity is also influenced by previous one. Yeah, that's correct. Physical activity is also influenced by more than individual choices because children's behaviors are shaped by many interconnected factors like schools, neighborhoods, design and safety, transportation systems, social norms, policies, and access to resources. The Community Preventive Services Task Force issued recommendations for future research to provide an evidence base for physical activity programs that target schools, families, workplaces, and built-in environments. Many existing studies focus on single settings or short-term outcomes, limiting understanding of how coordinated cross-level strategies influence sustained behavior change across the life course. So there's a clear need for research agenda that includes multi-level interventions to show promise for promoting physical activity, and yet many research gaps remain. Next slide. In NIH, we have several avenues to promote physical activity research to help identify research gaps. The NIH Physical Activity Scientific Interest Group serves as a central coordinating forum for discussing physical activity-related research gaps relevant to prevention science and facilitates collaborative research initiatives. Physical Activity Scientific Interest Group representatives include staff from NIH institutes, centers, offices, and CDC. SIG activities include workshops, seminars to identify research gaps, publications, and more that contribute towards increasing the research impact. As you can see, a few other channels to promote prevention through physical activity, such as Pathways to Prevention workshops, Prevention in Focus webinars, and early stage investigator lectures, which some of you may be familiar with and even participated in those. Thank you very much. I've provided some examples of physical activity related activities happen through those avenues and channels, but I don't really have a whole lot of time here today to go through all of them. Our Pathways to Prevention workshop happened a couple of years ago on can physical activity improve health of wheelchair users conducted I believe it's around 2020. And so if you have not seen it, I encourage you to check this workshop recordings, reports, and publications to look at the research gaps. So the project that we are discussing today is a result of an idea from a physical activity scientific interest group members, and some of them have joined the call today. Next slide. Research on physical activity and obesity is very broad, and physical activity research spans many disciplines and sectors. Research gaps, priorities, and recommendations are spread across guidelines, reports, federal strategies, and a vast abundance of academic literature. This really makes it hard to see the full research landscape to identify priority gaps, coordinate efforts across the fields. A cohesive research agenda accelerates the translation of evidence into effective interventions and policies, supports equitable, sustainable physical activity promotion, and maximizes the public health impact of research investments. Next slide. To advance physical activity research effectively, the field needs a shared view of key research opportunities, alignment across disciplines and sectors, a way to connect research, policy, and practice. So with this in mind, this project was conceived. It all started with the CDC presentation at the Physical Activity Scientific Interest Group meeting on gaps from community guided recommendations, physical activity guidelines, and more. And then the discussions on the need to pull together disparate research recommendations, approaches for narrowing and prioritizing mostly from the federal documents into one place. So these discussions led to the development of the PARO framework, or the Physical Activity Research Opportunities Framework. Next slide. The framework consolidates years of research recommendations from disparate resources into a single source. And the framework was developed to bring structure and coherence to a fragmented body of physical activity research priorities. And our goal for the framework is really to serve as a tool for advancing physical activity research agenda into cohesive and efficient manner. The recently published manuscript, Development of Physical Activity Research Opportunities, describes the analysis and framework. I will not give you any more details. Our next speaker, our SME, Dr. Laura Ballas, will share details about the development of the framework with you shortly. Next slide. With that, I want to highlight our work group members from NIH, CDC, Center for Nutrition, and NCORE. Thanks to all of them for their insights and scientific expertise to move the project forward. Many of them are on the call today. Back to you, Karen.
Thank you so much, Brahma. So let me now hand things off to our next speaker, Laura Bayless, who's going to talk with you about the development of the PARO framework. Laura.
Okay. Thank you, Karen. And thanks, Brahma, for giving us the background on this project. So next, I will talk about physical activity research and give us a little history there. So physical activity research began in the 1950s with a focus on epidemiology and health outcomes, which was followed by research on determinants and correlates and policies, and then more recently, intervention studies. That work all led to the establishment of optimal types and doses of physical activity, with multiple countries establishing physical activity guidelines. However, we have a gap from research to practice. So we have the research, we have the physical activity guidelines for Americans, we have multiple compilations of evidence-based interventions with demonstrated effectiveness across settings and populations. But most Americans don't meet physical activity guidelines, and health disparities persist across race, ethnicity, gender, education level, age, geographic location. So this gap between research and practice is not unique to the field of physical activity promotion. It exists across prevention science and healthcare fields and others, where the data show us that translating original empirical research findings to real world practice often doesn't happen at all, or if it does, it takes 15 to 17 years on average. And there's a lot of reasons for this gap and this time lag, more than I can get into today, but a few reasons. We know there are challenges with getting research disseminated to those who can use it, and then helping make sure it's adopted and implemented and maintained in practice. There's also the traditional research pipeline where work typically moves slowly from efficacy under tightly controlled settings to testing effectiveness in more pragmatic ways to then dissemination and implementation. We also have to align with funder priorities and academic publishing requirements, which can shift us to do certain types of research over others. So these all affect the types of research that are conducted and then the types of interventions that are available to move into practice. So next, going back to our timeline, most physical activity research in the last 2 decades has been observational or descriptive studies. Next, they are focused on often prevalence or health consequences, but few studies examine intervention effectiveness or dissemination and implementation efforts. And of those intervention studies over the past 2 decades, most are at the individual or interpersonal level, although we've known since about the early 2000s the importance of policy systems and environment interventions, or what we call PSEs. As Rama talked about, there's all those different influences on our patterns and practices. And then a lot of studies have been conducted that affect or address familiar questions rather than asking and answering novel questions that could have more of an impact on improving health. So based on these trends, better focusing the physical activity research agenda could support researchers and others, funders, policymakers, to conduct and collaborate on research across the translational science spectrum that answers those high priority questions and supports the scale up of effective interventions. So government and international and national nonprofit organizations have begun this work. We've seen a lot of publications on evidence gaps and recommendations, or what we call opportunities, in consensus documents and reports and in other formats. These examples call for better surveillance and improved rates of physical activity referrals and screenings and policy research and more studies in real world settings. But as Brahma mentioned, a challenge is that these different opportunities to advance the research and practice are not currently housed in one centralized accessible location. So this can prove challenging for researchers and practitioners, funders, policymakers, really anyone who's interested in knowing what today's most pressing issues are to navigate efficiently. So the purpose of this study then was to identify, synthesize, and categorize physical activity research opportunities into a conceptual framework to advance research more efficiently. We did a qualitative document analysis study that we combined with consultation from the NCORE group subject matter experts throughout each of our 5 phases. And next I'll share the methods for each phase. So the first phase was document identification, where the subject matter experts identified documents that included opportunities for advancing physical activity research. Our criteria to be included was they had to be published by a government or national nonprofit organization, as these groups use more rigorous methods and typically vet documents through some type of a comprehensive clearance process. And they had to be published in 2012 or later. That aligns with the first version of the physical activity guidelines mid-course report. So allowing a little bit of time after the first version of the physical activity guidelines. So with this, we did not include any individual research articles or systematic reviews. The second step was document review. So these documents that we included were then reviewed to identify and then extract opportunities. They had to be related to physical activity and relevant to advancing research. 2 researchers reviewed the extracted opportunity statements to ensure that they included one unique idea, that they were relevant to physical activity versus nutrition, for example, and that they were clear and understandable. Statements that included multiple concepts were separated into individual statements. So, for example, there was an opportunity statement related to family and home-based interventions that called for conducting observational studies, testing specific strategies, and comparing intervention effects by group. That became 3 different statements. We also removed any duplicates. Next, after reviewing the list of opportunities, the expert group discussed variables that could be used to code and categorize statements into a framework. So we developed a coding guide with 4 categories. The first one is translational phase. This was developed by adapting existing translational science models that are developed more for biomedical sciences typically, and talk about moving from bench to bedside to community. I'll talk a little more about these because they will come up throughout the presentation. So methods and measures development refers to creating or validating tools or measures related to physical activity. Etiology is the causes or origins of physical activity patterns or practices, including barriers, facilitators. Intervention development is designing programs, policies, practices. Efficacy, as I mentioned, is done in more tightly controlled settings, while effectiveness research is more pragmatic under real-world conditions. Dissemination and implementation is any calls to intervene to improve adoption, implementation, maintenance of interventions, scaling, dissemination. And then surveillance is related to monitoring or tracking physical activity rates or physical activity environments. Intervention levels, that was based on the social ecological model and the health impact pyramid. Priority populations were defined in alignment with the physical activity guidelines for Americans. So although this group, of course, were interested in child health, we also wanted to be comprehensive and include all of the age groups here across the lifespan. And then setting was either clinical or community, and community was any setting outside of healthcare that influences individuals' daily lives. So 2 researchers coded each opportunity according to this coding tool and then reconciled any discrepancies. So next, we did data synthesis, where the goal was to group similar concepts, because we found a lot of opportunity statements, into broad overarching statements that could be more useful for creating our framework. So one researcher reviewed the opportunity statements by different combinations of coding variables and suggested those that could be grouped together and condensed. So for example, we looked at all the opportunity statements that were coded as etiology research at the PSE level for adults in community settings. And then we would adjust a variable to create another grouping and review that until we found those that really helped group similar statements together. A senior researcher then reviewed and finalized the suggested groupings and wrote a new opportunity statement for each group. So next I have an example of that, where we have 6 statements that came from 3 different sources. And we grouped these together because, as you can see, they had similar translational research phases, similar intervention types related to active transportation, land use, and similar settings, being in communities. So then a new combined statement was written that summarized those 6 statements. Next, the final step of the synthesis process was coding, again, those condensed opportunity statements. As we were doing this, the expert group recommended adding a health equity variable. We noticed a lack of health equity considerations and a need for that to be included in physical activity research, which aligned with NCORE and member agencies' priorities. This was a dichotomous yes or no variable, so we coded it as yes if the statement explicitly mentioned social determinants of health, health disparities, reach, or tailoring an intervention to improve reach, or analyzing results by population. So finally, two researchers independently coded the condensed opportunity statements into those final 5 variables, reconciled any discrepancies, and then moved on to the framework development phase. Here, we used cross-tabulation analysis for each combination of the original coding variables to examine relationships between the 4 variables and determine which combination would best organize and illustrate the condensed opportunity statements versus which would leave too many gaps. So for example, if we organize by setting and intervention level, we ended up with few PSEs in clinical settings versus other combinations that really showed the nice distribution of what we found. So in this example, we have intervention level by priority population. So next, moving on to our results, we identified 11 source documents. They were published between 2012 and 2022. Most were authored by government agencies. We extracted 385 opportunities from those source documents. So this is just a snapshot of the documents that contained the most opportunity statements. So as you can see, the greatest number came from the Community Preventive Services Task Force findings in the 2018 physical activity guidelines, where there are many gaps and calls for more research that we were able to extract. So the original and combined statements were primarily related to effectiveness research and PSEs or cross-cutting interventions, meaning they included both PSEs and individual level. There's an example of a cross-cutting intervention. So this is an opportunity for an electronic resource for faith-based organizations to access evidence-based programs, and we know that those programs exist at multiple levels. Next, for the rest of our data coding and synthesis results, most statements called for research across the lifespan versus specific age groups. Most took place or called for work taking place in community settings, and there were few that included health equity considerations. And again, we only coded that during the second phase where we were looking at the combined statements. So next, after reviewing the cross-tabulation data for those different combinations of variables, the subject matter experts and the project team decided that translational phase and intervention level was the combination that best presented the data and allowed for interesting results and some meaningful framework tables. So this led to the PARO framework, and what the actual framework is 6 different tables, one per translational research phase, that include the physical activity research opportunities by intervention level. It includes the presence of health equity considerations, the number of original statements from which the combined statements were derived, and references to the source documents if people want to go back and see where those came from. So this is one example. This is the methods and measures development opportunity table. And then next we have one more example, which is the dissemination and implementation opportunities. And there's a lot here, so we encourage you to read the paper, but a few things to mention here is that in this table, we not only have opportunities to conduct research on specific interventions, but we're also interested in advancing the research on implementation strategies, technical assistance, and community coalitions are mentioned, along with dissemination methods, just as a few examples. So looking at things that can support intervention, adoption, implementation, and maintenance. So next, as part of the framework, we also developed a visual of our translational research phases, where here we have the evidence-based physical activity interventions that exist at multiple levels. And then we have those informing opportunities for our methods and measures development, etiology, so on, each of the phases through a bidirectional relationship where the research then informs adaptations or establishing the evidence, and health equity ideally is integrated each step of the way. So what does all this mean? The framework shows growth in the field of physical activity research based on the opportunities we extracted. There are a few remaining gaps, though, in better translating research to practice. So first, we were surprised at the lack of statements with health equity considerations. This may indicate a need to better integrate community and practitioner engaged approaches like community-based participatory research to tailor interventions and to improve reach. Next, there were fewer opportunity statements related to efficacy or etiology research than effectiveness research, but we know there is still a need for those studies to build the evidence and lead to establishing effectiveness and then disseminating and implementing. So this can be done, we recommend, with an eye towards dissemination and implementation from the beginning to lead to interventions that are more likely to work in their intended real-world settings and more likely to benefit populations that experience health disparities. And then most of the opportunity statements were related to interventions at the PSE level, and we know that those are challenging to evaluate because they are in the real world and require complex research designs. So we suggest collaborations between researchers, policymakers, and professionals from multiple sectors to move that work forward. So next, on a related note to those collaborations, the opportunity statements in our work are framed as research opportunities, but we think that they can be useful for multiple audiences that might be interested in advancing them. And we think there are a lot of prospects for collaboration. So, for example, just considering this opportunity statement, which is about developing conceptual frameworks and measures to improve social determinants of health. Funders could advance this through providing support to researchers who could engage with practitioners to develop a pragmatic framework and measures that would work in the real world. And practitioners could contribute by forming those multi-sector collaborations, for example, between urban planning, transportation, parks and recreation sectors, and our public health sectors. This could strengthen proposals and strengthen the collaborations with researchers. So next, there are a few limitations to our study to mention. So first, this was not a systematic or other structured review. We relied on the subject matter experts' knowledge of current physical activity promotion efforts, so knowing what was going on nationally in the government and across different groups, and knowing which documents existed that we wanted to include. So as always, there's a potential to miss relevant source documents. Next, the number of the original opportunity statements that was condensed into each combined opportunity statement should be interpreted with caution. So the frequency doesn't necessarily equal the need to advance that work. There were 19 statements related to physical activity interventions in school settings. So this doesn't mean it's an area that's more important or has more need. It could just mean that there's more interest in this area. And there were, in this case, multiple reports that were specific to youth physical activity that we included. It was also difficult to determine the translational phase of some of the opportunity statements, just depending on the amount of detail that was provided. So, for example, one of the statements was related to assessing reliability and validity of surveillance questions. That could be methods and measures development. It could be surveillance. As another example, sometimes it was hard to tell if the opportunity was more related to efficacy or effectiveness research. So our takeaway here is just to use flexibility when interpreting the statements and when choosing designs for your own future research. And then as a disclaimer, the framework is intended to synthesize opportunities in those consensus documents and reports and guidelines, but it's not intended to state the official positions of the federal agencies or their priorities in their annual plans. And then finally, the physical activity priorities can and should change over time. So the framework may need to be updated in the future to remain relevant. And next, a few conclusions. So overall, the opportunities noted here are consistent with current trends in physical activity promotion, where we're calling for more effectiveness and more dissemination and implementation research and more studies addressing PSE level interventions. We need additional work and additional evidence to enhance our ability to achieve health equity for all and to ensure that health benefits reach disinvested communities and populations experiencing health disparities. And ultimately, we hope that the PARO framework can serve as a useful tool to identify future directions in the field of physical activity more efficiently versus relying on recommendations from multiple different reports. Okay, thank you. And I will turn it back over to Karen here.
Thank you so much, Laura. The great presentations, and we've already got some questions coming in. So I really thank you thank both of you for the presentations today. I wanted to say to everyone who is in the audience that we would really like to hear from you. And there are two ways for you to participate today. First, we hope that you will comment on our LinkedIn post about what you learned from the webinar, thoughts that you have from the presentations, and you can you can use the hashtag Connect Explore and look for us on LinkedIn at NCORE. So that's the first way that you can let us know what you thought of today's webinar. And then second, we have a chance right now for your questions for the speakers. And I just want to remind everyone to enter your questions in the Q&A box below. That's where we'll get them from. And we've already got a few to start with here. So let me go ahead to the first one, which I think, Laura, is one for you. And somebody is asking if you could say a little more about the early phase studies designed for dissemination and maybe what some of the specific topics are that the experts suggested in that category.
Sure. So what we're talking about there is that if you're doing an earlier phase study, so thinking about the efficacy studies, if you're testing a new intervention that you've developed and it's in a controlled setting, if you're doing like a randomized controlled trial, we still encourage beginning with the end in mind or designing for dissemination or whatever phrase you like to use, where you think in the beginning about including the community members or participants or patients and the implementers to make sure that what you're designing would be likely to work for them. So thinking about collecting some data on things like feasibility and acceptability, and maybe doing some qualitative work to get input from different parties as you're rolling out your study. So, for example, there's a statement on build evidence of efficacy for primary care physical activity intervention. So if you were doing that, working with the providers and the staff and the patients is an example.
Great. And Brahma, if you want to add anything to that, feel free to. Otherwise, I have a question for you as well.
We're good. Laura did a
Okay.
great job.
Okay. Okay, great. So, question for the identification phase. Does that mean that academic institutions are part of government or national nonprofit organizations, or were they excluded?
No, so academic institutions are not considered part of government or national nonprofit organizations, and they're not excluded from the identification phase. As Laura said earlier, so we wanted to focus on a few documents, and that's how we've started. But there's always opportunity to add additional research gaps and expand the scope of it later on. But for now, these are the selected sources that we've focused on.
And so a question for both of you we can start with Laura first and then go to you, Brahma. Can you talk a little bit about some of the strengths of the PARO framework when applied to public health research?
So, what, they, There are several strengths. I think it integrates the translational research phases with socio-ecological levels, and that itself is a very important point, and which will really help us to identify where the research is, at least for the opportunities that are identified in here. And then it also encourages alignment between the research policy and practice related statements, and it highlights to some extent on the equity and real world effectiveness and implementation. And so it has several components like that, it's adaptable across population settings and intervention types. So maybe let me leave it at that, and definitely we consider those as strengths.
Anything you'd like to add, Laura, in that one?
Sure, I'll just add when thinking about public health practice and research, I like to think about the overall public health impacts and getting beyond just effectiveness of an intervention, but thinking about who's reached and who's not. I think the framework includes that with the discussion around health equity considerations and how to improve them, or the inclusion of those considerations. And then also thinking about, are these interventions taking place in the real world? I think we also support that through that translational science framework and thinking about the dissemination and implementation throughout the process.
And another question, Laura, for you, how do you see the PARO framework helping design research questions related to physical activity?
Sure. Well, we hope that it's useful where researchers can think about either what type of work they usually do and then refer to that section of the framework, where if you're someone who is really an expert or enjoys doing research on surveillance, we've got something for you. If you're someone looking at methods and models development, you can go there. Or you could also start by thinking about your interest in policy research, for example, and looking at the PSE level opportunities in each section, or just searching for specific keywords that you're interested in, whether that's school-based settings, active transportation, or others.
Excellent. And we have another question, which is a little bit if whether you could share a little more, Laura, about how PARO will guide equity research, and particularly the need to directly address inequities in income, housing, transportation, that sort of thing, to address health.
Sure. So I'll reference our publication again, and hopefully we can share that. I think we'll share that right after the Q&A. So we go into a little more detail on what we recommend. So we recommend things like, as I mentioned, community-based participatory research or integrated research practice partnerships, where you're working with the implementers or the community members to figure out how you need to adapt and deliver things, or design interventions to work better. And then I'm peeking at this question too. And yes, I think that changing the traditional research pipeline is recommended, to using some of those frameworks and models that include community members throughout. I know we always have constraints, research constraints for our studies, but as much as we can, doing that engaged research and working with community members and trying to kind of speed things along and think about how many years it's going to take from developing something to getting it rolled out, and where can we save time and be more efficient, and decide that we have enough evidence to move to the next phase and test things in the real world, or start thinking about and testing implementation strategies. So lots of ideas there.
And Brahma, anything that you'd like to add on this issue?
No. Sounds
Okay.
good.
Okay.
Clear.
So a couple of other questions that we've gotten here. I wanted to let's see. Yes. So, how do you see the PARO framework supporting implementation research? And I know you just mentioned implementation, but maybe you can talk a little bit about how implementation research fits within the framework and how the framework can support it.
I just probably want to add, Laura is really good at this, but I just want to add that the framework has translational phases, and dissemination implementation is one of the important phases in there, and it filters the opportunities through that particular phase. And I think by looking at those statements, and it'll really help us to utilize for the implementation research. That's probably a simple answer. I'll let Laura add to that.
Yeah, that's a good answer. And I'll try not to talk too much about this, which I could because this is my focus area. But I think if you're interested but not trained in D&I yet and you want to be, reach out. We have resources and ideas and happy to chat about that. But yeah, I think there's the specific table in the framework that is the dissemination and implementation opportunities that we pulled from all of those source documents that you can think about as priority areas. And then again, you can also learn about, if you're not familiar, or use methods to really think about those considerations from the beginning, if you're working in the earlier phases, because we know we need all the phases of translational research and they're all important. And someone asked about our next grant based on this work, and I think we're probably all in the same boat where it's challenging and trying to be creative and look at a variety of funding opportunities from government to foundations to other. So no solid answer on that one yet.
Karen, I just want to add to what Lara said about this implementation piece. I just want to share with our audiences, we've actually done a poster at the Dissemination Implementation Conference highlighting specific opportunities related in that area back in December. And also at the earlier last year Active Living Conference, we have done a specific session on in implementation phase. So if you have specific questions or, kind of what we did, or if you'd like to talk more, we're happy to connect and answer those.
Thank you so much. All right, so another question that we have here is whether it's okay to adapt the framework for your academic or professional field, and maybe how you can adapt it.
Let me try that. I mean, I think the answer is yes. It is possible to adapt, and it can be tailored to certain areas better than the others. But I think it depends on what kind of sources that you choose and, how you collect. And the most important thing, Laura and team have done an exceptional job, combining all these statements. And, as Laura was mentioning earlier, there were several opportunities that we collected in different stages and combining them and making sure bringing them into one location. So it's really important we look at that. And so the short answer is yes, there is a possibility it can be used, but we need to be really careful.
And final question here, how do you see the PARO framework helping to advance childhood obesity research specifically?
So definitely, I think we have, maybe I'll just start and Lara, please add. So it has, several evidence gaps across the etiology, effectiveness, and implementation. There are several gaps that are based on children, and as you see, we've looked at various populations, and focused on specific areas. So by looking at that, and I think if you kind of filter it, you can identify opportunities that could help, advance physical activity and childhood obesity related research. But you can also kind of filter the opportunities in many different ways to identify as well. But yeah, I think it could be useful, very useful. Laura, would you like to add anything? I think
No,
I'm having a lot of praise for the framework, and I think it is possible. Go ahead.
That was great. Nothing to add on that. I'm still thinking about the question around adaptation, though. I think that there's two parts. Maybe one, like Brahma talked about, is like adapting, I think, our methods for other subject areas. And I think, yes, that can definitely be done. Um, the methods could probably be different depending on where the research is at in different fields. I was reading a like call to action on maturing the field for nature and health the other day, and I think in that field, I don't know that there are as many like government reports, so it might be more of a systematic review would be more appropriate. So yes, use our methods or others, whatever works best, and then for adapting the actual framework, always a fan of adapting versus making new frameworks if possible. But I don't know that, a lot of adaptation is needed. I think people can really just pick and choose what they're interested in here and use that to set up rationale for their next study or their next grant proposal to be able to say, this is identified by, these subject matter experts as a priority area for my work.
Well, I want to say again, thank you to both of you for being here today. This has been a fantastic look at the PARO framework, and just wanted to alert the audience that there's a link in the chat to where you could learn more at the journal about the PARO framework. You can take a look at the journal link that's in the chat right now. And we would also love to hear from you on LinkedIn about how you're using the PARO framework. So please let us know and let us know what you thought of the webinar as well. And again, thank you to our guests for today. You can also use the QR code on the screen for to access the journal article. So you can go to the link in the chat or use the QR code on the screen in just a moment. Bringing the slides back up here. All right, so I wanted to go through a few announcements for you before everybody takes off. We wanted to let you know that NCORE is proud to announce several new resources. The first one is the Implementation Science Scorecard and Case Study. And that is designed to help practitioners spot strengths and blind spots as they move through the 4 phases of implementing new interventions and programs. It also includes a companion case study that illustrates how a nonprofit utilizes the scorecard to adapt and implement an existing evidence-based meal delivery program. And you can find the implementation science scorecard at the link in the chat. Also, please be sure to check out another new NCORE resource, which is the Opus Learning Guides. And just as a reminder, in 2024, NCORE hosted the Obesity-Related Policy Systems and Environmental Research in the U.S., or OPUS workshop series. And that workshop explored the importance of policy systems and environmental interventions to improve nutrition and physical activity access for children, their families, and communities. And NCORE's latest resource is designed for professors, students, early career researchers to access some easy takeaways, key takeaways from the Opus workshop series and incorporate those lessons into the classroom and into applied research projects. So we hope you'll check that out. Also, don't miss NCORE's latest publication in the American Journal of Preventive Medicine. It's called Advancing Policy Systems and Environmental Change Research to Reverse Upward Trends in Obesity Prevalence, a New Call to Action. And you can find it at the link in the chat. You can also now register for NCORE's next webinar, which is Supporting Recess in Schools, Evidence, Health Impact, and Action. Register for that webinar, which is going to include experts from the Bloomberg American Health Initiative and the University of California. They'll be discussing the development and practical applications of the Recess in Schools toolkit, and they'll also explore how researchers and practitioners can use that resource to inform policy and practice. And that webinar is scheduled for March 10th from 3 to 4 p.m. Eastern Time. So you can use the link in the chat to register for that. Also, if you are interested in checking out some of NCORE's past webinars, you can go to our website at ncore.org and you'll find there the links to recent topics, including understanding weight stigma, sleep's role in child health, and nutritional implications of GLP-1 medications in obesity care. So please take a look for those webinars. You can watch the full recording at those links. You can also sign up for the newsletter to get updates on the latest NCORE publications, tools, and resources, so you'll never miss out on the newest things that NCORE has produced. Sign up for the NCORE newsletters at ncore.org/e-newsletter. We would also love for you to check out our Student Hub webpage. That is at ncore.org/student-hub. And we love our students and hope that you will let us know how you're using NCORE tools, and maybe we can feature your story sometime soon. And that goes for all researchers as well. Anybody in today's audience, if you've used any of NCORE's tools, we'd love to hear about it. So please reach out to us at ncore@fhi360.org. And remember to follow us and like us on social media if you don't already. You can find NCORE on Twitter or X at NCORE, and also on Facebook at ncore.org. Look for us there on both of those platforms. And we encourage you to take the post-webinar survey that's going to open up when this webinar ends. So I want to say thank you to all of you in our audience, and thank you again to our guest speakers for today. We really appreciate you being here for today's Connect and Explore webinar, and hope you have a good rest of your week. Take care.